What do advanced scans show about bone TB? Imagine trying to see inside the bones and joints to understand how tuberculosis has affected them. Advanced scans like magnetic resonance imaging and other techniques give us a detailed picture of what is happening inside the body. Bone tuberculosis, also called musculoskeletal tuberculosis, can involve bones, joints, and nearby soft tissues. It is caused by the bacteria that lead to tuberculosis, which can spread from the lungs or other parts of the body. Detecting it early is important for effective treatment, and advanced imaging helps doctors do just that. Magnetic resonance imaging, or MRI, is the most powerful tool for visualizing bone tuberculosis. It provides high-resolution images of bones, joints, and soft tissues. MRI can show areas where the bone has been destroyed by the infection, which appears as dark or irregular regions. It also reveals the presence of granulation tissue, which is part of the body's response to infection. This tissue can cause cartilage and bone damage, and MRI can show how extensive this damage is. Additionally, MRI can detect complications like joint swelling, excess fluid in the joint called effusion, and soft tissue infections such as abscesses or inflammation of tendons and muscles. Ultrasonography, or ultrasound, is another useful imaging technique. It is especially helpful for examining soft tissues around joints. Ultrasound can identify joint effusions, thickening of the synovial membrane, and collections of pus called abscesses. It is also used to guide doctors when they need to take fluid samples from joints or soft tissues for laboratory testing. This helps confirm the diagnosis of bone tuberculosis and rule out other conditions. Computed tomography scans, or CORT scans, are often used in lung tuberculosis but can also help assess bones. They are good at detecting subtle changes in bone structure, such as small areas of destruction or abnormal growths. However, they are not as detailed as MRI when it comes to soft tissue involvement. CORT scans can be helpful in complex cases or when MRI is not available. Nuclear medicine imaging, like positron emission tomography combined with computed tomography, known as PET-CT, provides a different perspective. It uses radioactive tracers to highlight areas of active infection. PET-CT can identify multiple sites of disease throughout the body and help monitor how well treatment is working. Active tuberculosis lesions tend to take up more tracer, making them easier to spot. All these advanced scans play a vital role in diagnosing bone tuberculosis. They help doctors see how much damage has occurred, whether the infection is spreading, and if there are any complications like abscesses or joint destruction. This detailed information guides treatment decisions and helps monitor progress over time. While MRI is the most comprehensive for soft tissue and bone detail, combining different imaging methods can give a full picture of the disease. Remember, if you suspect bone tuberculosis or have symptoms like persistent joint pain, swelling, or unexplained bone pain, it is essential to consult healthcare professionals. They can recommend the appropriate imaging tests and develop a personalized treatment plan based on your specific condition.